Hello everyone. This video will be exploring the social, emotional and physical needs of learners with primary disabilities. So students with disabilities live most of their lives with limitations, or may have only experienced some of their limitations fairly recently. Those with a primary disability are defined as having had exposure to alcohol in the womb, and it can often be referred to as fetal alcohol spectrum disorder. So as within the longer name, this is a spectrum, and all students with a primary disability will present in an individual way, but many of them face similar difficulties in some of these main areas. Those with primary disability socially may act a lot younger than their age. They often would prefer to play with children who are younger than them and seem to engage in activities and tasks that are a few years younger than where their peers are at that point in time. They have poor social skills. They can be very misunderstanding of personal boundaries and be very close to you. They don't really understand the need for personal distance or for people's personal bubbles, as it were, and they find it difficult to relate to their peers and to communicate with them in an appropriate way. Moving on to the emotional needs, there is an inconsistency with their emotions, and they will not always react the same way to the same situation. One situation that may have caused a behavioural meltdown one minute may cause tears or create an inconsolable child the next time it happens. So there's no consistency there. They're also unable to put things learned into practice, so they may fully understand the theoretical reasons behind social skills and emotional skills, but putting those into practice is really difficult. They may understand that if somebody says something mean to you, that you don't hit, you don't retaliate back, you should go and talk to an adult. But when it comes to it and somebody actually does say something to them, they won't be able to think about those theoretical tools. They'll just act with their emotions immediately. And because of that, they can also struggle with the consequences because they have the understanding of what they should and shouldn't be doing. But that inability to put those things into practice means they often do not understand why they are faced with consequences. They can therefore often feel quite an unjust unfairness with consequences that are put in place. So the physical needs that come with a primary disability include hyperactivity, impulsivity, so just doing something without thinking, being quite disorganised. You'll often find that their bag is very messy. They may have a lot of things and a lot of nice new things that parents have bought them, but those things are all over the place, and they will need support with things like homework, organising their belongings. They may also have poor, fine or gross motor skills and need a lot of support in developing those, especially in primary school. Handwriting may be very difficult to develop and they may be better with typing. They may also have a high or low pain tolerance or sensory sensitivities. So they may appear to fall over or bang their head and it doesn't affect them at all. They could be bleeding and not really notice it. Or equally, somebody could touch them on the arm and ask them to play, and they could feel it like an electric shock and they can cry out in pain. So those sensitivities or tolerances can either be really high or really low. So just to recap, primary disability is commonly associated with those children who've been affected by alcohol when they were at certain stages of development in the womb, and as a result, they require support, kindness and patience from people like you in order to progress.